The most important and most common disease, diabetes mellitus. What is diabetes mellitus? It is the group of common metabolic disorder that share the phenotype of hyperglycemia. That is several and distinct types caused by complex interaction between the genetics and environmental factor. Harrison classification of diabetes mellitus on the basis of etiology. Number 1 is type 1 diabetes. Number 2 is type 2 diabetes. Number 3 is specific type of diabetes. Number 4 is gestational diabetes. Number 1, diabetes, type 1 diabetes. In type 1 disease, the patient have autoimmune disease that body produce antibodies against the beta cells that called immune-mediated beta cell destruction, that usually leading to absolute insulin deficiency that cause type 1 diabetes. And type 2 diabetes is a wide range from predominantly insulin resistant relative to insulin deficiency, and second is predominantly insulin secretory defect relative to insulin resistant. Third is specific type, and fourth is occurs in pregnancy. In pregnancy, increase the insulin production. The cell become insulin resistant due to the high level of insulin. The hormones responsible for cell resistance due to the human placental lactogen, progesterone, and placental growth hormone. Third is specific type of diabetes. In third is number 1 is genetic defect of beta cell development or function due to the mutation. Genetic defect of beta cell development or function due to the mutation. Transient neonatal diabetes mellitus. It appear with first few weeks of life, but it is transient. It due to the disease of exocrine pancreas, that is pancreatitis, pancreatectomy, neoplasia of pancreas, cystic fibrosis, hemochromatosis, that is iron overload, or any other pancreatopathy. Fourth is genetic defect in insulin action. Fourth is genetic defect in insulin action. Fifth, due to endocrinopathies. First is acromegaly, that happen is due to the high level of growth hormone. Cushing syndrome, that is due to the high level of cortisol. Glucogonoma, that is a alpha cell pancreas tumor. Aldosteronoma, that is a non-cancerous tumor of adrenal gland. Hyperthyroidism, that is increased thyroid hormone. Pheochromocytoma, that is the tumor of adrenal medulla. Somatostatinoma, that is the very rare but highly cancerous tumor of pancreas or the part of intestine. The part of intestine involved with that is duodenum. Drug induced diabetes mellitus, that is a drug that antipsychotic drug, hydantoin, thiazides, glucocorticoids, beta adrenergic agonist, epinephrine, and alpha interferon. Seventh is infectious, due to the infection, that is congenital rubella, cytomegalovirus, and Coxsackie virus. Another form is uncommon form of immune-mediated diabetes mellitus. Stiff person syndrome, that is autoimmune neurological disorder. Anti-insulin receptor antibodies. Last is genetic syndrome that is associated with diabetes, like Down syndrome, Klinefelter syndrome, Turner syndrome, Wolfram syndrome, and myotonic dystrophy.